when we think of cardiovascular system, we think of the ability to carry oxygen and nutrients throughout the body. So we think of heart and we think of circulatory system. So cardiovascular system is one of those systems that's not only does it affect the whole body, but it's also affected by the whole function of the body. Our cardiovascular risk is affected by hormones, it's affected by thyroid, it's affected by adrenal functions, it's affected by nutrition, and in turn, it's crucial for everything else to work optimally. When I think of cardiovascular testing, most of us die of heart attacks and strokes, and so it is important to make sure that our cardiovascular system is working well. Western medicine excels at treating acute coronary events and such as heart attacks and strokes, but the consensus is that we're much better preventing altogether than we are trying to treat at some point in life. One of our pet peeves is that the majority of cardiovascular treatment tends to center around lowering blood pressure and lowering cholesterol, and typically both with medications that many times have negative side effects. Part of that is fueled largely by pharmaceutical industry and by expensive and effective drugs that treat those conditions. But it's important to look at the whole picture and not just focus on two markers. When I think of functional testing or a more complete testing of cardiovascular system, we look at things such as cholesterol, but not only total cholesterol, LDL, HDL, triglycerides, but other markers such as lipoprotein A, which increases clotting risk, and we try to look at particle size. Do we have large cholesterol molecules that bounce off the artery walls, or small cholesterol particles that penetrate the artery walls? We think of oxidative stress, and because it's not that LDL cholesterol is bad, is that LDL cholesterol is the one that can get oxidized in our arteries. And so if we have less oxidative stress, or if we have evidence that we're not oxidizing our fats, then that LDL cholesterol may not be doing any damage. We think of markers like C-reactive protein that measure inflammation. We have to have inflammation to clog up our arteries. We think of homocysteine, which itself can damage the lining of the arteries. And in fact, I think it's more important than cholesterol as far as cardiovascular risk, yet it's treated with trimethylglycine, folic acid, B12. We think of other hormones such as testosterone, estrogen levels. We think of nutrients such as B vitamins. We think of vitamin D and a whole host of other issues that affect cardiovascular system. And the take-home message is when we test and we try to ascertain how well we are from a cardiovascular risk standpoint, it's important to use a panel that's comprehensive and not to limit it only to one or two things only.